Looks like Dr. Kris, looks like we're streaming at Facebook, YouTube, a few other places. If you're listening, be sure to chime in. Let us know if you're hearing us, seeing us. Dr. Kris, how are you?
I'm good. It's been a busy week so far, but that's all right. That's the way it usually is.
What's going on this weekend? You're going to go talk to some people?
Yeah, so two good friends of mine, Leonard Pastrana, who's been on the podcast before, and Abid Hussein, amazing cardiologist. We're having a longevity course that we're giving in Chicago this weekend for BioT providers. So it's sold out. We're excited about it. And so we'll be heading out that way Friday.
Look at there. He's speaking at sold out venues now, be it internationally too.
Yeah. We actually have been, we're able to announce now we've been rebooked to go to Sun, Sea, and BioT in Cancun, Mexico in September. So Lexi, you, myself, and Leonard will be speaking at that, which we did as well last year. So that's already on the books as well for later in the year.
There you go. So he knows what he's not only running a successful practice, he's out hustling, telling people, sharing the message. I want to run the intro, and then we'll get to our topic about what happens with your lifestyle over 40. Here we go. If you're like most folks Dr. Kris Fusterhausen works with, you're active, you want to take ownership of your health, and you want to age gracefully. The problem is there is so much conflicting information out there about health and wellness, it's tough to know who to trust. Most providers are limited by what insurance will approve. So it can seem like they're only able to help you manage your health decline with more meds. On the Dr. Kris Life Podcast, you'll learn how you can regain your confidence in your health journey. You'll learn helpful knowledge about programs, supplements, peptides, and hormones that Dr. Kris has used with thousands of patients just like you to help them crush their goals and be their best selves. So if you're ready to take charge of your health and are wanting to stay active and healthy, so you can be a better parent, partner, or lover, then you're in the right place. Welcome to the Dr. Kris Podcast. So, optimizing men's health in your 40s and beyond. Now, ladies, if you're listening, this is focused on men, but really the men, they're not. You're going to have to tell them what to do anyway. So, this is a good place for you to be.
True story. So many of my guys come in. I'm like, why are you here? Because my wife told me to, so yeah, true story.
It is. It's like they're the last guys to go to the doctor. But, when we talk about the folks that you work with, they've already gone over the bridge of, hey, it's time for me to step up and take ownership of my health journey. And now I'm picking a partner, Dr. Kris. I understand I'm going to have responsibilities here, and I'm going to have to make some changes. And that's what we're talking about today. Men over 40, they face a number of changes. I've experienced that. It can impact your energy levels, health, your vitality, and it can also impact your self-esteem. So luckily, with these lifestyle changes that we're talking about today, you can take charge. You can feel better about what you're doing. You're not just being a victim. You're being a victor. Dr. Kris, what do you say when the guy comes in, he's 40 years old and goes, hey, my caboose is just not jugging like it used to?
Yeah, it'd be great if every man really started thinking about their health well before 40. But I think 40 is kind of that number where a lot of times guys start, I think there's some stats that actually show believe it or not, we're fairly invincible to about 50 years old. Now, that doesn't mean that people don't die before 50. I'm not trying to say that. But if you look statistically, we pretty much, whether this was the 1700s or today, everybody kind of lived to about 50. And 50 is where the wheels really start to fall off. That's where actually chronic disease really starts to spike and people start to actually have true illness and rapid aging. That doesn't mean that we can't get hit by the school bus and die at 25, or some people get cancer and die and things like that. But statistically, we're pretty good to about 50. Now, I don't know about you, but I felt like even as a physician, I felt fairly invincible until my late 30s. Like, it's fine. The truth is that sure, we're not going to die most likely by 50 unless something really bad happens to us. We may not even start to see diagnosable chronic disease until about age 50, but these problems start well before that. In other words, my point is you just didn't get your 50th birthday. I'm 53. And then all of a sudden on your 50th birthday, like, oh my God, I have diabetes or whatever. And so I think that 40th birthday can be really for a lot of guys that wake up, that reminder like, hey, I really need to probably start working on my health. I like to say it's kind of like a 5 or 6 year old pickup, right? Like they're fairly invincible for the first few years. Change oil, you're good. But then, when you start getting 100,000 miles, you better start really, really taking care of it. Kind of like that with guys. And so, typically, most of the stuff that we're probably going to talk about today isn't earth shattering. It's just reinforcement of the simple things that we have to do. And like you and I were talking about the course we're going to give on Saturday, and there was 3. I did one section, and maybe this be for a podcast, maybe even our next podcast, talking about NAD plus. NAD plus is like this cofactor that we use in so many different enzymatic processes in our body for metabolism, cellular communication, whatnot. NAD plus is a very common topic today amongst patients, social media, you name it. And I have patients asking about it all the time because it's a buzzword, right? I always say in longevity, there's these buzzwords like cellular communication, metabolism, NAD plus. My point of this is that a great way to increase NAD plus naturally is something that you and I have talked about many, many times. Get a good night's sleep. As we age, we typically don't sleep as well. I'm a huge fan of sleep monitoring. We're going to start off with the basics here. Monitor your sleep. As you start to get older, stick with routines. God, let's Scooby-Doo forward to retirement. The worst thing you can do with retirement is lose your routine. I used to go to bed at 9:30. Now I go to bed at 1, sometimes 10, sometimes 2, and they get their circadian rhythm completely jacked. Sleeping is so important. I think we should monitor sleep. I think we should be addressing sleep. Super important. First thing in the morning, get out and get sunlight in our face. That actually helps sync that circadian rhythm. So that's why is the earlier you can get outside and actually get sun into your face. You and I talked about it before we jumped on, where so many of us today are sedentary, right? Like, we sit at a desk all day, sit in a chair all day. I don't necessarily sit at a desk, but I sit on a stool, like room to room to room. And, we're actually meant to be outdoor beings and not to get too naturey, but this whole grounding with the earth and stuff like that. I mean, I think there is something to it. I really, really do. I think the more outside we can be, like I have one guy follow, he's like, take off your shoes and walk in the grass and all this stuff. And, I think there is something to that, but my big thing is the sun, getting that sun in your face at 6:37 in the morning for about 15 minutes. So that goes back to sleep. Fasting and caloric restriction. Fasting and caloric restriction naturally raise NAD plus. By the way, guess what fuels aging? Lack of NAD plus, right? So ways to naturally raise NAD plus without taking fancy shots and IVs is sleep good at night, fast and calorically restrict like we talk about. In other words, have a timing schedule with your eating. Go, long periods of time without having calorie intake, and exercise in the morning. You and I talked about that off video. Exercising in the morning will ramp up your NAD plus synthesis. So these are great little tips as we age. Like, when you're 25, it doesn't matter really if you exercise in the morning, afternoon, night, whatever. Do it. Hell, you can probably exercise at 9 o'clock and go to bed at 10 o'clock and sleep like a baby. I go exercise at 9 o'clock and I'm not going to fall asleep till 2 in the morning. So as we age, these things become more important. So my point of that is as we age, our lifestyle, we have to refocus on our lifestyle. Just because you could do it at 20 and 30 doesn't mean it's okay at 40 and 50. And then to finish up the lifestyle talk, alcohol. I would probably say that's probably one of the biggest factors that I have to counsel my patients on. And, it's universal now. We have one acceptable level of alcohol intake, and that's none. We all agree now that the only helpful, harmless amount of alcohol is none. I don't ask my patients to be non-drinkers. I think that's a little bit extreme, but I do say, we can't drink daily. We can't drink large amounts, especially daily, because alcohol is such an inflammatory product. Because at the end of the day, aging gracefully is all about lowering inflammation, keeping our hormones right, keeping insulin sensitivity high and insulin resistance low. This isn't rocket science, although we can make it that way. Actually, I had a guy I was talking to the other day, and he's super funny, and he's like, "It's not like this is rocket surgery." And so I was like, "That's my new favorite saying, mess up that saying rocket surgery, but this isn't rocket surgery." I just think there's really simple things that we can do, and we can certainly talk more about it. But I like to start with just those simple lifestyle changes.
So when you're saying NAD, we're talking about that little bitty cell. This is what, you and I've had, I don't know, hundreds of conversations, okay? And it's made a difference in my health, I believe. But when you started talking about this inside that little bitty cell, what's going on, a lot of dots connected for me that helped me focus. Everybody's looking for that one thing. Just tell me one thing to do, doctor. That was a big thing for me.
Yeah, and the truth is what may be the one thing that connects the dots for you may not be the one thing that connects the dots for the next person, but there is a skeleton framework to everything that we must have, right? Like I always say, like when I teach to other providers, there's so many different ways we can go, and many times it's not that any way is wrong. It has to do with what fits the criteria for the patient the best and what is the provider you're most comfortable with, taking into effects race, taking into effects activity levels, taking into effect cultural limitations. Like I have a slide that basically says high Hispanic population where I live in Texas. Okay. And, I'm a believer. I'm not necessarily a believer in diets, but I am a believer in lower carb intake, lowering the glycemic intake. But if I told every Hispanic in Texas that I saw they could no longer ever have a tortilla again, well, I'm going to lose those patients right away. So my approach to that person needs to be different. Like, hey, what foods can we limit or what can we work on? And we didn't even discuss earlier. We talked about sleep. We talked about exercise in the morning. We talked about fasting. What we eat is so important. I always like to say mom was right when she says you are what you eat. Okay. And by the way, don't be fooled by the bullshit food pyramid in America. Okay. That's a bullshit thing. Pardon my French. We should not be having 50% carbs per meal. That's way too much. I like for my patients to understand what's healthy and what's not. Let's break it down into simple things. What foods are good? What foods are bad? And not necessarily is that the same for every person, but if you can just understand what's healthy and what's not, because so many of our patients are ignorant would be the term, because that just means that they think it's healthy, but it's not. So many food companies today, they do such a great job of trick you into thinking their junk food is good for you. Even like protein bars. I'm blown away by how many people bring in high protein, what they think are protein foods. And it's like, that's a candy bar with a fancy wrapper. And just trying to understand what's good and bad. And if we can then just limit what we know is bad for us, dabble heavier in what's good for us, time our eating, fast when appropriate, we're going to have really good jobs. And then really one of the big things that we like to focus on is discussing exercise with patients. And if we could for a second go down that path a little bit. So if I've got a high muscular guy, but he is high on body fat, then I'm going to try to tailor some exercise to him that's going to be more on the fat burning side versus the muscle building side. Because if he has an excess in muscle, that's great. I need to get the fat off of that guy versus like, let's say a lady who has a little too much fat, but not a lot of muscle. Then we kind of got to walk that line of building a resistance program with cardio so that we can do both at once. So you just, as a provider, can't look at every patient exactly the same. You have to know how to look at these patients. And, I'm a big fan of KISS, keep it simple, stupid, these programs don't have to be difficult for most people. And then, of course, blood work, like actually bringing these patients in and looking at their labs. I believe that there's an absolute epidemic on low hormone values in young patients today. And if you were to ask me why I think that is, I think it's because of we're overstressed, we're under-rested. So we're overstressed, under-rested, and the food that we intake for decades, for the most part, has been horrible. And that's one of those things that I think RFK is going to make some changes and maybe make some baby step improvements. But let's not kid ourselves. The food industry is a multi-billion-dollar, maybe trillion-dollar industry, and they have a lot of pushback on this stuff. And, you're just never going to convince me now that we have chickens twice the size and half the time because we pump them full of things and genetically modify them and then we consume them. And no, Steve, that's fine. It's okay. It's perfectly healthy. No, it's not. And so that's why you're seeing so many people getting back to, having chickens in their backyard and raising their own eggs and things like that, which I think is great. I don't do it. I wish I did. I just don't have the time for that. So thank God I have good patients that bring me eggs. But anyway, just a few things that patients can work on.
So when we're thinking about issues that men face after they get to 40, I used to giggle about, there was all this focus on, this heart conversation around your heart for men. And it's like men don't care about that. But had the conversation been around the other body part, erectile dysfunction, they would have been perked up and started listening, because that's a big indicator of there's other things wrong other than just.
Yeah. So let's just use the stats. 40% of 40-year-olds have some form of erectile dysfunction, 50% of 50-year-olds, 60% of 60-year-olds. So there is a good percentage of 40-year-old guys walking around with the inability to get a erection to the point that they feel is like when they were younger. And that is probably the quickest way to get a guy to actually come in these days, is have erectile issues, sort of. I will say that actually I think now with these online, no real doctor involved things like, well, I won't use the names because I don't want anybody to come after me. But we all see these commercials now, and basically it's this AI generated programs where I'm not quite sure that you ever really see a doctor. They just screen you out and they send you Viagra in the mail or whatever, right? And there's good to that. I mean, I'm appreciative to the fact that guys are having access to these things, but I also think that it's a negative because they're not getting their proper screening and educating on that erectile dysfunction can be a sign of much bigger problems. So the first thing that we always talk about with a guy when he comes in who says he's having some erectile issues does he have any family history of heart disease? Is he having any symptoms himself that could be related back to heart disease? And has he had any advanced imaging or studies done to check his own heart? Because remember, the most likely way anybody who ever watches this podcast or is part of this podcast dies and leaves this earth is a cardiovascular event. Okay. You can add up 2 through 5 and it doesn't exceed 1, which is death from cardiovascular reasons. So that's the way most of us leave this earth. God forbid, cancer is a horrible disease, but we still die more frequently from heart disease exponentially. Okay. And so the good news today is like I tell all my guys, we need to really be thinking about our heart health at 40, at minimum 40. We need to know that there are advanced testings out there that can, and you and I have talked about the Clearly scan that, I'm a huge proponent of. I've been using it now for a couple years. I can easily say that every year I believe we save two or three guys' lives with this test. People that are totally asymptomatic that we find severe disease. I'm talking about severe disease. Just last year, we've talked about it, but we had one patient 2 weeks later have coronary artery bypass, another one get 2 stents. within a week or two after having the clearly scan. And that doesn't even talk about the guys that we find early disease and we implement, programs to slow down their disease. So how many of those guys are you saving? So erectile dysfunction is a huge, huge problem. I don't mind saying, I had issues with erectile dysfunction in my early 40s, and that's kind of what got me going down the erectile dysfunction path. Luckily, today we have so many good things that we can do for guys like PDE5 inhibitors, which is Cialis, Levitra, Viagra, but we have actual ways to reverse erectile dysfunction that are non-invasive. We even now have a home device that guys can go home and use it at their own discretion, that they don't have to come in and, as I always joke, have one of my staff members shock their penis. Okay. That sounds worse than it is, by the way. It actually is fairly painless. But we now have home devices that they can do that. Then that increases vasculature. It gets rid of those microcalcifications that restrict blood flow to the penis. But what is an erection? Erection is nothing more than blood flow to the tip of the penis. If blood flow is restricted to the tip of the penis, it's not like vascular disease only picks your penis to attack. Okay, so it's important that we also have the heart checked out, making sure that we don't have any significant restrictive issues there. So I always just say ED sometimes, I know this is a weird concept, can be a good problem because it might clue us into a bigger disease, because so many times the patient meets their cardiologist in the emergency room for the first time, if they made it to the ER. So ED is something we routinely treat. We have a lot of different options for those patients: PDE5 inhibitors, peptides, injections like PRP injections, like exosomal injections, all the way up to devices like low intensity shockwave therapy and hormone replacement. I do always tell my guys that testosterone replacement does not fix organic ED. It will fix the get up and go, but the actual process of that comes into those things that we talked about prior to hormones.
Yeah. Hormones is a big deal, actually, but now it's not that hard of a treatment, really.
No, super simple. And I mean, the good news is I've been doing this long enough. I think I've been doing this for about 16 years actively, hormones and this type of medicine. And when we started, it was just kind of in its infancy. And, I've joked on this podcast many times, you can't listen to terrestrial radio more than one commercial break before you hear some form of a local hormone ad, right? And so here in the Metroplex, we have our own ad that runs that I hear all the time. And so it's just so widely accepted now. And I just want to reiterate, about a month and a half, 2 months ago, the black box warning was taken off of testosterone, which we've known was BS for a really long time. And that black box warning basically said that testosterone worsened heart disease. And we actually know it's exactly the opposite. I'm privileged enough to be lecturing this weekend with a triple boarded cardiologist, Dr. Hussein, who will tell you how it's vital for his heart patients to be on testosterone replacement if they're deficient for their heart health. So luckily, finally, it's one of those little things that I think RFK got pushed through, getting that black box warning taken away from testosterone. Because every now and then I would still have an uneducated provider, or cardiologist be mad at me because my patient's all on testosterone, and now that's been taken away. So I don't have to have that battle, hopefully, any longer.
What's the biggest misconception about hormone therapy?
That it's unsafe. I still think that's the biggest misconception, that it's going to cause cancer, that it's going to cause me to have a heart attack, that the safety data is not there. When I believe that. So first of all, I say there are always safety risks with anything in life, right? Like I always joke, this water can be dangerous. I could technically drink so much of this that I could kill myself. All right. Is that likely to happen? No. Testosterone, when used appropriately, is extremely safe. Now, that's why you need to have a provider that understands what's appropriate, things to look for, labs to check, monitoring, and that sort of thing. But the biggest misconception that is still out there is that testosterone is has not been studied enough, which is total BS. That it's not safe, that it causes cancer. These are all just false things that we hear not as much as we used to. Like I said, today pretty widely accepted. I just don't get too many of those comments any longer.
And now it's bio identical. Am I saying that correct?
Bioidentical, yeah. So, like in our office, bioidentical is typically going to be like gels and creams and pellets. And so, typically, your injectable hormones, your oral hormones, many times, some of your oral hormones are synthetic, some are bioidentical. But for the most part, your bioidentical hormones are going to be your topicals, your transdermals, and your pellets. Which, from our past conversation, we actually work directly with BioT, which is the only publicly traded hormone company in the United States. We actually run their pelleting clinic in Irving. So they have 3 headquarters, but any provider that gets trained through BioT Irving comes through our training clinic to learn how to do the procedure of pelleting. So we're big pelleting fans, and that's using bioidentical hormone replacement. That term is exactly what it says is what it means. It means it's all natural. It's from a plant, and it's identical to the hormones that are the testosterone and estrogen molecules that are already in a person's body. So not close to it, not like it. It's identical. So, as I always tell guys, I think it's an easy concept to understand that if I give Steve Brown something that his body exactly has, just not as much of it, and I'm just going to give him some more back, how that's probably going to cause less problems than something Steve Brown doesn't have in his body. Because we're giving them exactly what they already had, just a little more of it.
Yeah. And that's the main theme of the treatments that you recommend when we're talking about peptides as well. That was like real easy for me to understand. Basically, we're sending an email to that part of the body to just make more. You don't have to hoard it because you're worried about how long this person's going to live, right?
Yeah, there's peptides are nothing more than chain amino acids that send signals. They're signaling agents. So you said email. I like that, actually. I might start using it. I always go old-timey, and I say it's like levers in a theater. You're flipping a lever to cause an action for the curtains to go down or the curtains to go up. And, the big thing with peptides is, and with hormones, there's good and bad with them becoming peptides and hormones becoming so standardized. The good thing is that I don't get hardly any pushback anymore when we talk peptides or hormones, because even a patient that hormones are like, peptides are kind of like where hormones were 10 years ago. 10 years ago, hormones were becoming standardized and accepted, but people knew what they were, but they still had I'm not quite sure what you're talking about, but I know you're talking about something within my body. So peptides have gotten to that point now where people don't usually know what a peptide is, but they're comfortable enough having the conversation because they've at least heard the term enough. And I think in another 5 or 10 years, peptides are going to become so commonplace that we'll be talking about it like hormones. But the bad is now everybody does hormones and peptides. And I guess that's my pet peeve, is that I don't believe every provider necessarily has the education level commensurate with using some of the peptides and hormones that they do. But with that being said, as long as you have a good educated provider, I believe that both of these modalities can be used very safely to guide you through your aging process.
Awesome. So if I'm over 40, I'm a man, or maybe a wife of a man that's over 40. What's it look like? How do they get in contact with you? How does that experience happen in the beginning?
Or heck, even come together, right?
Yeah.
We'll take the ladies too. But yeah, it's just a phone call. So, we're here in Texas. So if you're local, you're welcome always just to stop in. And anybody local knows where we're at. But most people are going to call in or go via our website and click on the link, and that'll start the process. Typically, that'll put you in contact with my virtual employee. Her name is Lauren. Lauren typically will call, and if you don't answer, she'll email you, and she'll she'll bug you for a couple of days trying to get you to respond to her. And then, from there, we like to start off by just figuring out what it is that you want help with and making sure we're a fit. We're not always a fit. Believe it or not, sometimes people call us and they want things that we might actually send you somewhere else. The good thing is I have a wide network of providers, and I think we're really good at what we do, but we're very kind of regimented in what we do. So if it falls out of that, we'll be glad to try to find someone that fits your criteria a little better. So we just try to tease out what you're looking for if we think we're a good fit. And then we'll just walk you through, figuratively hold your hand through that process of what it's going to look like. It's typically going to start with blood work, and then it's going to sit down. It's going to look like a consultation with either myself or one of my other providers to get you, into our program. And basically, I tell my patients all the time, we are not a high stress, pressure based practice. I'm going to come in, I'm going to tell you what I think you can do, how we can help, and you're going to make a decision how we fit into your life, whether that's just one visit, which I hope it's not, or whether it's for the rest of your life. We'll fit in it how you want us to.
Yeah, I've been there. And so it's not like the typical doctor experience where the doctor comes in 30, 40, an hour late, spends 5 or 6 minutes with you, and then is gone. This is a totally different experience. You spend a lot of time with folks, you get to know them, you understand them. And so if
all of our first visits start with an hour. Like I typically never spend less than an hour with the first visit. Hour's my limit, though. I always tell everybody after an hour, your brain turns to mush, and probably happened before that. And I'm talking about both of our brains. And we start, that old saying of a fire hydrant hitting you in the face, you're only swallowing so much water. So we start every visit with an hour. And then typically after that, our visits are 30 minutes at a clip. And then we just continue to break down things. I always tell people, I'm not going to fix you in one visit, not even trying to do that. We're just trying to get a starting point. And, we love, our wheelhouse is taking reasonably healthy people and getting them healthier and helping them age gracefully. That's what we like to do most with our clientele.
Yeah. So if you're wanting to take some responsibility of your health journey, and you need a good man to help guide you through that, then that's Dr. Kris. You can go to the researchclinic.com. So Dr. Kris, you're going to go and give a presentation here coming up. Where is it again?
Chicago. So yeah, we sold it out there. It's actually at one of the hotels by the airport, and we're doing this, and we got another one already scheduled in November. Plus we got Sun Sea on the books to lecture at that in Mexico in September. I'm sure some more things will pop up. This is kind of we're kind of entering the slower season of education. So we'll see how the next few months go, but things come out of the woodworks as we get through the year.
All right. Good job. I'm going to run the outro. Thanks for joining the Dr. Kris Podcast. If you learned something today and you want to connect and get more information, visit our website, www.drkris.life, where you can find more great information or even schedule a time to learn how you can engage with Dr. Kris. Be sure to follow, like, share, and we'll see you on the next episode of the Dr. Kris Podcast.